The initial goal was to put up that firewall, to get to those people so that if the disease was going to spread quickly, it wouldn't spread as quickly if you've got those amount of doses. Since you didn't get those, do you think it's getting too late to put up that firewall to try to prevent this thing from spreading faster than it already is?
Not really. This vaccination can occur during the second wave and potentially third wave well into the winter, and we fully anticipate providing vaccination into the spring. Remember, not everyone will become infected from the first or second wave. The attack rates could be as high as 40%, but also, again, there's many types of diseases circulating now, not only H1N1, that are resulting in influenza-like illness. Granted that H1N1 is on the rise, we believe, but it's not too late to get vaccinated now or in the future.
On the flip side of that, you had 6,500 or 650 left over from the last go-round. You got 5,000 coming now. It doesn't seem like you're getting overwhelmed, that people are just rushing through the door to get this vaccine, given how concerned everybody should be about it. How do you sort of put that in context?
Well, it's a little deceptive. The 650 doses that we had left over with the intranasal version, and there's many contraindications to receiving that vaccine. So pregnant women can't receive it. Anyone with underlying health risks cannot receive that, and individuals that are not between the ages of 2 and 49. So in some ways, it's very restrictive. We're going to look very, very closely at the uptake for the injectable version of the vaccine, and then have a better idea, again, of what the total community uptake will be and some of the reasons people aren't availing themselves to this vaccine. We are concerned about it. We initially anticipated 40 to 50% of the population may, again, opt to become vaccinated against H1N1 flu. That's up about 20% from what we see for the seasonal influenza. But again, it's too early to predict. The intranasal had very, very restrictive, it was very restrictive in terms of who could receive it. So this will be, again, lessons learned on our part of the coming year.
Are you concerned at all about a rush for this injectable vaccine? These folks with asthma and pregnant women have been waiting a long time to get this. Are you concerned that there's going to be a lot of frustration if 1,500 isn't enough?
Yeah, I think, again, this may be difficult. We're going to be very pleased if people, again, avail themselves to this vaccine and get this out to the highest risk group. And I think there will be a very good turnout. And again, there are limited supplies of this vaccine, but more is on the way. People should not panic. More is on the way. And we fully anticipate holding additional clinics very shortly, in fact, in the coming weeks.
Why return to Sarah Middle School? How come you haven't tried something on the northwest side, other parts of the city? It seems like you keep going back to that school.
Well, we did do pre-planning at 3 sites, and there's significant pre-planning that goes into these mass vaccination clinics, including walkthroughs, clinic flows, security concerns, need for parking, availability for staging and queuing of patients, especially if there's inclement weather. So we picked these sites also based on availability. A couple of these sites are schools that are not currently being used, so we can open and close those fairly frequently. We have a good imprint at Sarah Scott. There's been good turnout. The clinic flow model works very well at that school. That's not to say we won't be holding clinics in the future at other locations, including South Division and perhaps a location on the far north side. So we've done significant planning at 3 large sites, which we felt would meet our capacity and the needs of the community during this vaccination campaign.
Anyone else?
Thank you very much for showing up, and we'll keep you briefed as more information is available.